Hello, Sarah. I'm pleased to be ready to go through your paper and talk through what I'm seeing and what's working and maybe a little bit about what you can revise. Okay, ethical issues in the medical field. We are all patients at some point in our lives. Wow, this is just seeming so important right now. Today, medicine is all around us. Healthcare has never been better, yet there are still some ethical concerns in the field. In this paper, I would like to explore some of the ethical concerns in this field and where they stem from. Okay, for my interview, I was able to interview somebody who works at the Mayo Clinic. That's cool. I don't know if I mentioned I watched some documentary about the Mayo Clinic, and I just found it so interesting. I think it was PBS. She is a registered nurse and she works in the emergency room. I asked her a number of questions regarding her position. I wanted to start the interview by getting to know her position a little bit better. I first asked her what her average day looks like. She said that she works 12-hour shifts and there are 7 different areas in the emergency room. What are the 7 areas? She is sometimes assigned to work in the trauma department, but she typically works in pediatrics. Each day looks different, and she is assigned to one area for the whole shift. What are the areas? I then asked her what she likes the most and the least about her job. She said that she loves helping people and being able to learn new things, but patients can be frustrating and even violent. Now I need a story of a patient being violent. Or even being frustrating. I understand there could be some concerns about anonymity. What do I want to say? God, I can't come up with the word. Protecting people's identity, your patients. But there may also be some way she feels comfortable sharing that kind of information, just with absolutely no identifying details, or telling someone else's story, maybe. When I asked her what the biggest challenge she faced was, she said the COVID-19 pandemic. Yeah! Sorry, I'm just laughing because it's so horrible. There have been constant policy changes with a new policy almost every day. She said this is the most challenging after 14 years of working there. God, I am sure it is. I then wanted to get into the ethical issues of the medical field. I asked her what she thought were some of the biggest issues in this field. She said that one of the biggest issues she has faced was dying patients and their wishes versus the family's wishes. That's a really good one to bring up. Sorry, my cats are yelling at each other. One little thing there, the family's wishes. Let's see, what did you do? You said dying patients and their wishes, so that's plural. So you can also have families be plural, but you still need an apostrophe at the end there to show that those wishes belong to the family. One of the most aggravating things in English, of which there are many, is the fact that in a word like there, we use the actual word to show possession, but with this apostrophe S nonsense, we use it to show possession in something like families. She said that this is a major issue because there is some controversy surrounding who gets the final say in what happens to the patient. I then asked her how she thought this issue should be solved. She said that they have a legal team on standby to give them advice on what they should do. So she's really answering about in terms of preserving your career, in terms of preserving your job and your livelihood. She also said that you must always make sure you are doing everything within the law and you always have to look out for yourself. Always within the law and look out for yourself. So she didn't really answer the question about, which I'm quite curious about, and I mean, she doesn't have to answer this, but I'm really wondering then, what are situations where she feels like you should do what you think is ethical regardless of what is your legal team tells you to do. Because that's also different than what the law actually says, right? Your legal team is going to be more conservative than that, which is their job. And then that part about you always have to look out for yourself, that confuses me a little bit. She said another big issue she has seen is access to healthcare. She says she has seen patients refuse treatment because they could not afford it. I'm sure that happens a lot. When I asked her what would be done about this issue, she could not really give me an answer. She said the issue of access to healthcare is so complicated, it's hard to give a good answer. I have a lesson in this part of the curriculum about fallacies, and that's a really great answer because one of the fallacies that I always like to teach has to do with People who propose simple solutions to extremely complex problems. And healthcare certainly fits into that category of when somebody tells you, oh, we'll just fix this one thing, and then it'll fix all of healthcare. Like, that's almost definitely not true. But I wish she had gone into a little bit about, like, what are some of the issues. I decided to look more into do not resuscitate orders, DNR. DNR is a medical order written by a doctor for a patient. This allows the patient, that's probably an instance of a place where you don't need to cite it, because I would say, like, that's the kind of thing they'll talk about on medical shows on TV and they won't explain, which says to me that that's probably considered common knowledge. But as I said, it doesn't hurt you to cite things too much. This allows the patient to decide whether or not they want cardiopulmonary resuscitation, CPR, or if they stop breathing. Okay. In order to get a DNR, a patient has to be considered mentally sound. If a patient gets a DNR, I think you mean, right? It isn't called a DNR, but decides they do not want one anymore, they can change their mind at any time, but their family does not have a say in it. If a patient isn't able to speak for themselves and there is no official DNR, then a family member or person previously designated by the patient is able to make the decision. Yes. There are some ethical controversies in whether or not a DNR should be respected if the patient is able to get better. For example, and that's a place you definitely want to cite because you're going into a specific place where it talks about those, right? And like, as just a regular old person who's not medical, I don't know what those are. For example, if a patient is able to get better, wait a minute, you already said that, but refuses treatment, ethical principles need to be considered. What ethical principles? Physicians and nurses face an ethical dilemma because they must always act in the best interest of the patient. Oh, I'd love to hear a lot more about that. Like, I don't know if you're going to talk about the Hippocratic Oath, but it seems like it's kind of like time to talk about that somewhere in here. So it's such an important part of medicine, I think. Maybe I should have shut my window too. What an exciting video you're getting. Okay. I also wanted to look more into the issue with access to health care. So I looked at Medicaid. Medicaid is a form of health insurance that provides health coverage to people with a low income, children, pregnant women, elderly adults, and people with disabilities. But the qualifications vary by state. Yes. I don't know if you'll get into distinguishing, though. Medicare is the one for elderly adults. One of the main qualifications is that you have to make 138% of the federal poverty level. Interesting. Is that true in all states? That was something I maybe thought states might decide themselves, but I don't know. As of December 2019, there are about 63.9 million Americans covered by this. Medicaid was signed into law in 1965 by President Lyndon B. Johnson. It is funded and regulated by both the state and federal government. So when you have so many citations like that, centers, I would look at ways that you can avoid doing that with every sentence. For example, you can do something like, according to the Centers for Disease Control, or I'm not sure that's who you're actually citing, but according to the Centers for whatever, or finding ways in your sentences to hook two of those thoughts together so you only one time have to say that. You can also think about ways that you can, according to the centers, and then say a bunch of stuff, as long as it's pretty clear to the reader that all those things came from that first source that you started from, that you mentioned at the beginning. I feel like I'm getting confusing now. Okay, it is regulated by the state and federal government. While it does give health insurance to low-income and other qualifying families, there are still some ethical issues. Although qualifying families are able to get health insurance through Medicaid, their access to health care is still limited. Yep, there are some healthcare providers that do not accept patients who have Medicaid. In fact, a study from 2012 showed that about 1/3 of physicians do not accept new Medicaid patients. That's a lot, I guess, right? Especially if, like, you live in a rural area where there aren't that many doctors to begin with. There was another study conducted by the University of Virginia that looked at a bunch of patients that needed a major surgery. The study concluded Medicaid patients needing surgery were 13% more likely to die than the uninsured, and 97% more likely to die than those with private insurance. Whoa, I want you to talk about that. It looks like you're going right on to, since Medicaid comes with blah, blah, what does that mean? Medicaid patients needing surgery were 13% more likely to die, and Medicaid were 13% more likely to die, and 7 more likely to... Okay, so it's like better to be uninsured? Well, regardless, like there's a lot of information there that I want to hear you take apart and say, here's the part I'm going to talk about Medicaid patients and what their deal is. Here's where I'm going to talk about how they compare with uninsured, and then talk about private insurance, because that seems like a lot of important stuff to talk about. Since Medicaid comes with high administrative costs and low payments, many physicians decide to not treat Medicaid patients. This is an ethical issue because many families in Medicaid do not have another option for health insurance. Well, I mean, by definition, I would say, yeah, they don't. They can't, or they would not be permitted to have Medicaid. This also raised the question, do patients get treated differently based on the type of insurance they have? I feel like there was one more thing I wanted to say here. I don't know, maybe you don't have time for this, or maybe you can do this in your last paper, but this issue of how Medicaid functions differently in different states is really huge, including the fact that in many states they have Medicaid expansion, meaning that Medicaid is open to a much larger group of people in the state who are not able to get other kinds of insurance, or just allow them to get a cheaper kind of insurance. However, Kansas has not done that. Missouri has not done that. So our situation with Medicaid is quite different than the situation in states that have made that change. In order to explore this question more, I looked up some different studies. The Minnesota Health Access Survey. I like how you're like inquiring. It's very you're doing this inquiry thing well, right? Looking at this, and showing with some transitions, some nice transitions, how you're moving from one to another. In order to explore this question more, I looked at some different studies. The Minnesota Health Access Survey questions 4,000 people about whether or not they have experienced discrimination based on what type of insurance they have. So this is separate from the idea that, you're not being discriminated against if they say you need X and you say I can't afford X. So I get, right? I think that's what you're saying. So like this is additional on top of that. Like not, you can afford it, but like, this is among that group of people, I guess. Okay. The results I found that people who were uninsured were the most discriminated against at 25%. Okay, so there I'm not sure what you mean. Next are people who were publicly insured at 21%, and people who were privately insured reported the least amount of discrimination. I really would love to know more about this, because this raises more questions than answers for me. Like, how do they define discrimination? As I said, like, if you are told about a procedure and you just can't afford it, I don't know if that's discrimination exactly, or if it's like society discriminating against you because they decided you're not going to be allowed to have health insurance. Okay, this type of discrimination could slow or rude treatment? You'll fix that. Not responding to calls or even showing a lack of effort in treating the patient. Oh. Wow. Another study from Florida found that 14% of Medicaid recipients experience discrimination based on their insurance. Again, I really want to know more about that. A pattern that I found is that there are no clear answers on how to solve the ethical issues in this field. One of the main issues was access to healthcare. This topic has been debated for decades, yet there are still no clear solutions. What benefits one group of people could disadvantage another? It could. I don't feel like you've really talked about that at all, so I would really like to hear more about that. Lowering the cost of healthcare to people with low income would also increase the healthcare costs of people with a higher income. That's definitely possible, but you haven't shown any research or any information from someone who knows about this to support that claim. You probably could find someone. I don't know. Again, this isn't what I know about. But you have not supported that claim. It became clear to me that there are some flaws in America's healthcare system, but it's difficult to point out exactly what needs to be fixed. These ethical controversies in medicine are not new, though. Healthcare has been a major topic of debate for decades. Wait, I think you already said that. And ethical controversies will keep coming up as time goes on. The contradiction I found is that some source in healthcare workers that all healthcare workers treat all patients equally. The other said there were some kind of healthcare workers that treat patients differently depending on what kind of insurance they have. So you're also, I feel like, I'm running out of time. I'll have to do 2 videos for you. I also feel like you're kind of, 2 issues are coming out here that aren't being distinguished. One is that you're suggesting that I don't even have time to finish this here. On to the next video.